apologies for being late. The last 2 days only just came to India. About 3 weeks ago I was in India, so I'm so glad to be here. I'm not from just USA, I'm from Andhra Pradesh too. I'm a dual citizen of this country, of United States and India. So I'm Indian too. Well, let me share some of the things I'm learning very late in my life. The definition, if you are still struggling with the definition of such a common problem, there is something wrong. To me, in medicine, wrong means we are not understanding the basic sciences yet. Remember, if anything you would like to take from this talk is understanding the basic sciences. So still, we are talking about of all these, how many millions of patients are there to dry eye. We are still talking about definition. This is a mixed slide. I have done this kind of talks probably in the last 15, 20 years when I got interested in dry eye. Keep learning with these experts. And the experts are the ones who keep learning. Those are called the experts. So I made this slide at one time. Especially I'm grateful to Shaffer Singh, who taught me a great deal about the ocular surface. Don't look at the cornea first at all, any external examination. Look at the lid margin, exposure, blink. Is it a complete blink, incomplete blink, like a partial blink or a complete closure? I think there's all this takes less than 30 seconds. But you get incredible information, and we won't be using the drugs like we are using. Most of you have done an excellent practice without any question, but still we keep on learning. 80% of the drugs, medications, are used by 20% of the population of the world. 80% are used by 20% of the population. So the symptoms so variable. So unless you really understand the basic sciences, as well as that clinically how you are going to distinguish what the patient is saying, we can be led in a very wrong way. It happens, even today it happens, and it happens to me too. So those are the symptoms that the patient with a dry eye can come. Leave alone that extraordinary severe dry eye patient who had punctate keratopathy and is miserable and his vision is affected. We are not talking about in a day-to-day, there are so many patients with a mild to moderate dry eyes. I think still we are excessively treating with medications, including me. Any of these slides, if you bring your flashcard or attach it to my computer, you can have it. This is not my property over this little. If you keep sharing the knowledge, I think that will retain with you. This is a little different from what the dry eye we all look at it. Non-Sjogren's type classification. So I'm not saying this is the right way to do it, but this attracted me many years ago. When we do not know, just give me a minute before Anita. Otherwise, I keep on going on. There's a little bulbs or somewhere but the dry eye never stop. Huh? Oh, okay, that's fine. If you look in a paper in the eye, an optometric group or optometrists leading this research, these are all brilliant, but we will not understand that we make it so complicated. LIPCOF, lid parallel conjunctival folds. This is already written as conjunctivochalasis. So when we are still struggling with the definition, we don't understand what to do, and another paper comes, that's all right, that's the hypothesis, and people trying to do that, but you need to understand. If we don't understand, somebody said it, Raju said it, so I want to give it, that's not the way to do it. I'll give you an example how early intervention, even the bad dry eye, bad problems, they look terrible, but it's a process started many, many years ago maybe. This is a child with Stevens-Johnson syndrome. We caught him within the first 36 hours under general anesthesia. We put an amniotic membrane, and that how after 10 days the child looked. That doesn't mean every amniotic membrane child will look like this, but I'm talking about catching them early. diagnosing them early, doing it right from the beginning, that requires understanding of the basic as well as clinical sciences. Here are some patients, look at that. These are all incomplete blink, partial blink. I'm asking them to blink, otherwise they're not blinking at all. And evaporative dry eye may be one of the most common cases we are facing. Some regional and global differences, but I might like to learn from you all how certain things I am looking at it may be different. Floppy eyelids. How many of us were late in my career, I was looking for floppy eyelids. I don't know whether that is common at all in this country. There are certain things we think, oh, this is not common here. Probably we may not be looking for it. Secretion, there is one is called tear spread. Think about it, tear drainage. We are all talking about the corneal sensitivity, and there is, as I said, I can't go through every one of them, but incomplete sensitivity, the eye that is neurotropic cornea is one of the worst form of dry eyes. And I don't think I use that in my practice, but if you are really research oriented, you want to change the science, you must use this. And dry eye and Western world, in my practice especially, allergies and dry eye, I'm struggling to still separate some of those mild, moderate people who are, there is a psychological overlap. One guy said he's a dry eye, the other guy said he's allergies. And we do, with not in my practice, but in my research unit with the group, this kinetic tear interferometry. They'll make you to understand, but it is not practically expensive. I don't think we'll do all these things. There's a vertical folds, if you can see, that is the lipid layer problem, and you can diagnose very well, but these are all still research tools. Think of potential masquerades, allergies, and the comorbidity. That's what we feel when the patient comes to early in their symptoms. You can miss, is it allergic, mild dry eye, or combination of the process? Because in my practice I found so many combination. Suddenly you give allergic drops, then the dry eye got worse. And there are so many companies, more than 12, 15 companies, each one says that is the best. Probably they're all very good ones, but you have to select for which patient. The cost containment, it's unbelievable how it is happening. In the last 30 years, there are 37 major breakthroughs in science, in medicine, compared to about just 30 years ago. In United States alone, the direct therapeutic costs about $4 billion because of the dry eye management medications. Even indirect, lost productivity is, you won't believe it, between 35 to 40 billion dollars. So they're always masking, so your eye examination, the 30 seconds or a half a minute examination could be very crucial when the patients are coming very early with the symptoms. The future, there's so much things, these are all one the bad ones we are talking about, but most of the dry eyes are, the day-to-day practice, they're very mild, very moderate, but if you have a clinical sense very well, understanding the basic sciences, we can do a justice and not to spend that kind of money for the patient. I want to mention, I don't know how common this is, conjunctivochalasis here. Lot of dry eye patients in the United States we see day to day. I do external disease practice, plus I do a lot of comprehensive ophthalmology I love. So, depends upon which specialist you talk to, they will say, oh, no, that's not true. This is right. That in comprehensive ophthalmology is very different from if you are seeing only the bad ones. So, this is a conjunctivochalasis patient, is very different from, his symptoms are the same, it may not be the dry eye. Otherwise, you can keep on doing, these are little case studies. We can, as I said, anytime, come with my computer, take me the talk, and we'll go differently. So, some of those serials show, SLK, they're all maybe simple conjunctivochalasis, maybe, that's an hypothesis at this time. Simple fluorescent test, how the tear meniscus looks, you can diagnose conjunctivochalasis and correlate the symptoms with the patient. And people, in extraordinary cases, we do those amniotic membrane graft. Most of the patients do not need such surgeries. and they look immediate. And the another one I want to start with, this is my interest for the last 5-6 years. Is there Demodex blepharitis in this country from the lashes? So I would like to hear from you some questions. I would like to say, is they're also like a little dry lie, they look like, but there's not the tears or meibomian glands, maybe a little meibomian gland problem too, but it is Demodex blepharitis. Thank you. Are there any cases